Humans have always lived with microbes in a constant process of evolutionary adaptation. However, only a few times in history has a microbe had such an impact on our civilization. BSI presents a journey to resilience as we recover and rebuild to create a safer, sustainable, and more resilient future. Disruptions can test our people and organizations alike, leaving incalculable emotional, social, economic, and supply chain impacts. In these times, organizational leaders need to adapt and adopt their working practices to address these uncertain and complex situations and ensure the safety and well-being of their workforce and their organization's resilience. BSI has stood strong for over 100 years, partnering with our clients through many challenging times. Through BSI's unique multifunctional approach, we support clients with their immediate needs as they rebuild, recover, and restart their journey to the next normal. We achieve this through our knowledge solutions, consulting services, training solutions, workplace assessments, customized audits, and hygienic workplace and certification. BSI's professional environmental health and safety, ergonomic, and industrial hygiene consultants are actively supporting clients across all industry sectors to identify critical areas of risk and to develop strategies for our new way of working. Our suite of training solutions allows our clients to efficiently respond, recover, and rebuild through effective education and training. We continue to innovate by developing cutting-edge training programs into effective, on-demand, app-based training solutions for our clients. To address the growing demand for organizations to identify where their immediate risk and vulnerabilities are, BSI has developed a comprehensive hygienic premises risk assessment solution. BSI recognizes our clients' need for independent verification that they're operating effective hygiene protocols for the safety and well-being of their workers and customers. BSI Kite Mark certification enables organizations to demonstrate that they have put colleagues and customer safety first when they display the mark of trust. Our unique journey to resilience is a robust way for our clients to implement effective workplace hygiene measures and build a safer, more secure, healthier, and sustainable future. We are ready to support you on this journey as we move out of the stabilized phase, start to rebuild and recover, and become resilient. BSI, protecting workers, customers, and businesses is key to building safe and resilient organizations. Talk to us today.
Is your organisation working safely during the COVID-19 pandemic? To be safe, you must adapt fast to new regulations and working practices, from hygiene and social distancing to home working and psychological health. You need to protect your people, build their trust and boost the confidence of your customers.
BSI was asked to develop guidance to help and support organisations of all sizes in enabling a safe and healthy workplace for their workers during COVID-19.
Whatever your organisation does, and wherever in the world you're based, ISO PAS 45005 will help you manage pandemic risks and reduce the spread of COVID-19. So you can keep working, minimise disruption, comply with the law, and keep your people safe and healthy.
ISO 45005 is full of practical advice. It does, for example, tell you how to manage your workplace. It sets out what you can do if you're working in an office, or if you're working in a factory or a place with fixed workstations. It also gives you practical advice on hygiene and how to manage best hygiene practices, when and how to use personal protective equipment.
This standard provides practical advice on social distancing and keeping any workers who may be at increased risk safe. It also provides guidance on keeping workers psychologically healthy during this pandemic.
One of the really great things that has come out of the last 12 months is the understanding that people are at the heart of every business's success. There's now a much more open conversation about mental health and well-being at work, and a recognition of just how important it is to look after people's well-being.
BSI can offer you a complete set of solutions, including the ISO PAS 45005 guidelines, safe working training, gap analysis to see what action you need to take, and independent certification and customised audit.
We recognise the challenges that the COVID-19 pandemic has brought to your organisation, and we want to help and support you through those challenges and make sure that you are resilient for the long term. At the heart of BSI is our desire to create trust, and that will be for your workforce and your clients, and also to look to the future and create a positive outcome.
This vital work is just one way we support the United Nations Sustainable Development Goals. Talk to us today. BSI, inspiring trust for a more resilient world.
Humans have always lived with microbes in a constant process of evolutionary adaptation. However, only a few times in history has a microbe had such an impact on our civilization. BSI presents a journey to resilience as we recover and rebuild to create a safer, sustainable, and more resilient future. Disruptions can test our people and organizations alike, leaving incalculable emotional, social, economic, and supply chain impacts. In these times, organizational leaders need to adapt and adopt their working practices to address these uncertain and complex situations and ensure the safety and well-being of their workforce and their organization's resilience. BSI has stood strong for over 100 years, partnering with our clients through many challenging times. Through BSI's unique multifunctional approach, we support clients with their immediate needs as they rebuild, recover, and restart their journey to the next normal. We achieve this through our knowledge solutions, consulting services, training solutions, workplace assessments, customized audits, and hygienic workplace and certification. BSI's professional environmental health and safety, ergonomic, and industrial hygiene consultants are actively supporting clients across all industry sectors to identify critical areas of risk and to develop strategies for our new way of working. Our suite of training solutions allows our clients to efficiently respond, recover, and rebuild through effective education and training. We continue to innovate by developing cutting-edge training programs into effective, on-demand, app-based training solutions for our clients. To address the growing demand for organizations to identify where their immediate risk and vulnerabilities are, BSI has developed a comprehensive hygienic premises risk assessment solution. BSI recognizes our clients' need for independent verification that they're operating effective hygiene protocols for the safety and well-being of their workers and customers. BSI Kite Mark certification enables organizations to demonstrate that they have put colleagues and customer safety first when they display the mark of trust. Our unique journey to resilience is a robust way for our clients to implement effective workplace hygiene measures and build a safer, more secure, healthier, and sustainable future. We are ready to support you on this journey as we move out of the stabilized phase, start to rebuild and recover, and become resilient. BSI, protecting workers, customers, and businesses is key to building safe and resilient organizations. Talk to us today.
Is your organisation working safely during the COVID-19 pandemic? To be safe, you must adapt fast to new regulations and working practices, from hygiene and social distancing to home working and psychological health. You need to protect your people, build their trust, and boost the confidence of your customers.
BSI was asked to develop guidance to help and support organisations of all sizes in enabling a safe and healthy workplace for their workers during COVID-19.
Whatever your organisation does, and wherever in the world you're based, ISO PAS 45005 will help you manage pandemic risks and reduce the spread of COVID-19. So you can keep working, minimise disruption, comply with the law, and keep your people safe and healthy.
ISO 45005 is full of practical advice. It does, for example, tell you how to manage your workplace. It sets out what you can do if you're working in an office, or if you're working in a factory or a place with fixed workstations. It also gives you practical advice on hygiene and how to manage best hygiene practices, when and how to use personal protective equipment.
This standard provides practical advice on social distancing and keeping any workers who may be at increased risk safe. It also provides guidance on keeping workers psychologically healthy during this pandemic.
One of the really great things that has come out of the last 12 months is the understanding that people are at the heart of every business's success. There's now a much more open conversation about mental health and well-being at work, and a recognition of just how important it is to look after people's well-being.
BSI can offer you a complete set of solutions, including the ISO PAS 45005 guidelines, safe working training, gap analysis to see what action you need to take, and independent certification and customised audit.
We recognise the challenges that the COVID-19 pandemic has brought to your organisation, and we want to help and support you through those challenges and make sure that you are resilient for the long term. At the heart of BSI is our desire to create trust, and that will be for your workforce and your clients, and also to look to the future and create a positive outcome.
This vital work is just one way we support the United Nations Sustainable Development Goals. Talk to us today. BSI, inspiring trust for a more resilient world.
Good afternoon to each and every one of you. Welcome to our webinar today titled ISO Pass 45005 Occupational Health and Safety Management System General Guidelines for Safe Working During the COVID-19 Pandemic. I hope everyone is doing well today. My name is Hannah Ramirez and I represent the marketing team of BSI Philippines. There you go. On behalf of everyone, we would like to thank you for joining us today. Now I will get the ball rolling. Let us call on our Managing Director of the BSI Philippines, Ms. Ava T. Tanyahura, for her welcome remarks. Over to you, Ma'am Ava.
I hope everyone is doing well and can hear me very well. Can you hear me, Hannah? Hannah, can you confirm that you can hear me?
Yes, I can hear you,
Okay,
Ava. How
thank
about Hannah?
you. Yeah. So a very, very pleasant afternoon to all. BSI Group Philippines is very honored to partner with the Association of Safety Practitioners of the Philippines in this event. Well, as we all know, COVID-19 has brought the world to a halt. But you know what? The world pushed back and said, hey, COVID, you cannot stop us from evolving. And so we did. We evolved. We saw nations, institutions, leaders, influencers, health and safety professionals, frontliners rally together in our own way and no matter how we can to get on with life and evolve as those who came before us did when they also experienced a global crisis of this proportion. I am very proud that just like many times in the past, BSI has risen to its challenge, to this challenge, to its promise of inspiring trust in a more resilient world, and developed, along of course with other experts, ISO 45005 as guidelines to assist organizations as we adjust to the way we work to protect our workers and the people that they come in contact with through work from the ongoing risk of COVID-19. And we are very fortunate to have our very own Kate Field, our BSI Group's Global Head for Health, Safety, and Well-being, to give an overview of ISO 45005 and more importantly, on its benefits. I am also very honored to have Jerry Valle Cruz, Board of Director of the Association of Safety Practitioners of the Philippines, to join Kate in this webinar to share effective ways in preventing COVID-19 in the workplace, the current situation here in the Philippines, and including some updates on our vaccination program. I am very confident that his practical experience in dealing with this situation will be very useful to all of us. Safety practice is very close to my heart. This is where I started, just like most of you probably. My first designation was a safety engineer or safety officer. I recall being interviewed in a panel in Intramuros in the Bureau of Working Conditions, carrying my documents to get my safety practitioner accreditation way back then. So it's really an honor to welcome everyone in this webinar, my colleagues in the safety profession. I remember saying then that this is not a profession, this is a calling. We are called to this because of our passion and commitment to making the lives of the workforce better. This statement echoes today more than any time in my life that I can recall, because this is the moment when we are called to action. This is the moment in history when we fought COVID-19 and all of us work together to kick it out of our lives. And these efforts are what we need to remember. Thank you very much and I salute all of you. Maraming salamat. Saludo ako sa inyong lahat. Thank you. Hannah?
Thank you so much, Ma'am Ava, for lending your time. I know you're also quite, loaded the entire day, but thank you so much, Ma'am, for sparing your time to be with us. And thank you also for sharing your wonderful remarks. Short, but very sweet. All right. Thank you, Ma'am Ava, again.
Thank you.
Now let's head
Thank
on to
you,
our
everyone.
first session for today. Let us welcome Mr. Jerry Valle Cruz. He is a certified Department of Labor and Employment Health and Safety consultant and also a board member of the Association of Safety Practitioners of the Philippines, Inc., or ASPI. He will be tackling on the topic of COVID-19 management in the workplace. Now over to you, Sir Jerry.
Yeah, thank you, Hannah. And also, can you switch the so that I can open my. Thank you. Just give me a few minutes just to share my screen. Okay, can everybody see the screen now? Yeah, can everybody see my screen?
I can see it, Jerry.
All
right, we can see your screen.
Yeah, okay.
Yeah, this is slideshow.
Okay, so good afternoon, everyone. Again, my name is Jerry Cruz, directors of ano nga is I'm also one of the graduates also of BSI. Communicate on certain things that is very important in our lives as of this moment, which is yung COVID-19. Okay, so today I will be tackling on the controls and preventions with regards to COVID-19. So alam ko naman na marami na siguro tayong mga can I just ask if you can see the whole screen or you can see me also? Kasi parang nako-cover lang yung
we can see you and the screen as well, Sir Jerry. Thank you very much.
Okay, so we know naman that COVID-19 has really taken on our lives. At sabi nga ni Ma'am Ava kanina is we're not going to let COVID-19 to take over our lives completely. Okay, it's going to be here, but it's not going to take over our lives. So what I'm going to discuss today is some certain points that we need to understand on how to prevent COVID-19 from spreading. At the same time, some updates also with the government's vaccination program. As you can see, currently right now, COVID-19 is in different battlefields. Marami tayong mga lugar kung saan nilalabanan natin ang COVID-19. One battlefront is in the hospital. One is in our workplace, and one is even in our homes, and one is in our daily activities. Gasoline stations, when we go somewhere outside our homes and outside of our workplace. This is today we will be tackling one basic battlefront that we always do, which is dun sa lugar natin is one major battlefront against COVID-19. Titingnan natin, no, for the past 3 months, there has been an increase of COVID cases. So kung titingnan nyo, the blue one is the daily COVID cases. And when you see at around April, early weeks of April, we were averaging around 10,000 to 12,000. The yellow one is the what do you call this? Recovery rates, and the line graph is what we call the death rates. So ang nakakatuwa nito is for the past few weeks, ang cases natin dito sa Pilipinas is steadily going down. We're now averaging from around 6,000 to 8,000 cases a day. And surprisingly, also, if you will have insiders in different markets like Korea, like Japan, like Thailand, like Malaysia, like Singapore, they currently have the surges as of today. Ngayon pa lang nagsisimula ang surges sa kanila. So as you can see, mas meron naagapan natin yung pag-daily surge dito kaysa sa ibang bansa. Kaya nga kung titingnan natin, no, if we try to listen to the news, let's also try to listen to other news in other countries. Kasi para mas lalo nating maintindihan saan na ba nag-fare tayo with regards to our COVID-19 response. But we're not going to talk about majority of the government's response. We're going to talk about today is paano ba tayo makakatulong dun sa response ng government na yun. Nyo, no? So kilala nyo naman kung sino to. This is Wonder Woman. I believe siguro napanood nyo na yung latest movie niya. So kung titingnan nyo, no, there are 2 ways we can battle COVID-19. One is the health protocols, and kung titingnan nyo, yan yung shield natin doon sa COVID-19. Yung sword niya, yan yung vaccine na pangpatay doon sa COVID-19. So there are two ways we can handle this. And these two, dati kasi, when I did this lecture before, isa lang ang pwede natin gamitin dyan, which is the health protocols. Ngayon, dalawa na. We can use the health protocols as well as the vaccines. With regards to the vaccine status in the Philippines, currently we have 7 approved with EUA. Pfizer, Janssen, Sputnik, AstraZeneca, Sinovac, and Moderna, which is the latest one. Novavax and yung Sinopharm is still waiting for approval. And we have these 7 vaccines that are currently now available to be distributed here in the country. So as of May 12, there's already 7,779,000 total deliveries of vaccines. 1 million from Sinovac, 2,556,000 from AstraZeneca, 193,50 doses from Pfizer. Around May, the target is around an additional 7,753,000. Around June, around 10,050,000 doses to be delivered in June. So kung titingnan po natin dito, this is hindi actually ito yung plan. There's a much bigger plan by the government. Kaso nga lang po, meron talaga tayong, there are different scenarios that we need to undertake here, like the surge in India, like the surges in other countries. So nag-hold back sila for the deliveries of their vaccines. But again, kung titingnan natin, no, if we really relied on certain vaccines before na talagang gustong-gusto natin, siguro wala pa tayong vaccines ngayon. So this is just looking at the facts that there are different vaccines that we can use, and we should not be, actually, sabi nga ng mga ibang mga doctors, let's not be brand cautious, diba? They always say that the best vaccine is the first available vaccine na pwede natin gamitin. Okay, as of May 15, the total administered for the first dose is 2,245,397 doses, and for the second dose is 714,432. The total distributed as of May 12 is 3,025,600. So there's a discrepancy. Sabihin nyo, nasaan yung kalahati? Well, the kalahati is usually they're keeping it for the second dose. Okay, so those are some things that is being followed by our LGUs. So when do we target getting what we call the herd immunity? So sabi ng study is when we get around 25 to 50 million, we can reduce the hospitalization, fatality, and deaths as of September 2021. And if ever we do get enough vaccines coming in the country, we may get 58 million to 70 million around November 2021 to prevent and contain. So if we ever achieve this on November, magiging masaya siguro yung Christmas natin. And if all the vaccines really comes in, na wala nang aberya, we might get the full immunity by second quarter with the elimination of the disease. So currently, as of May, ang ating fully vaccinated is around 432 fully vaccinated, and around 1.23 of the 58 million required to be able to get the herd immunity. It's still a long way, but we are getting there. Okay. So now we've talked about the vaccine. So paano naman yung health protocols na kailangan natin gawin? So with COVID-19 response, we need to do 5 things. We need to know, we need to plan, we need to implement, we need to sustain, we need to do prevention and control. So iisa-isahin natin to. The first one is we need to know. What do we need to know? With those who are on my same age bracket, so kilala nyo siguro si G.I. Joe. In one of their commercials, they would always say, knowing is half the battle. Okay. Mga naman, if we know the enemy and we know what to do, we've already won half of the battle. We don't go charging into a battle without knowing what are we facing, ano yung kinakaharap natin. Sabi nga ni Sun Tzu, if you know the enemy and know yourself, you need not to fear the results of 100. So your enemy, at alam mo kung ano ka, paano ka magre-respond sa enemy yon, then you will know how the result of the battle will be. So the question is to be asked, who is the enemy? COVID-19 is the enemy. It's not the person beside you. It's not the government. It's not the other country. It's not another country. It's not the opposition of the government. It's not the person sitting beside you. COVID-19 is the enemy here. It's not another person. Okay, always remember it's the virus, not the person. Okay, how well do you know what is COVID-19? How do I get infected? How well do you know the protocols? Do you follow the protocols? And how well do you follow the protocols? By simply asking these 5 questions, masasabi niyo na ba sa sarili niyo na, kaya kong makaiwas sa COVID-19? I'll give it up to you na kayo sumagot. Even inside you, let's answer this 5 question internally. Am I all doing these five questions honestly, ng maayos, para nakakatulong ako sa pag-prevent ng COVID-19? So know the basics, because COVID-19, as we know, is an infectious disease caused by a newly discovered coronavirus. So most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover with requiring special treatment. Times, older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, cancer, and more are likely to develop more serious illnesses. So that's the basic of COVID-19. Sakit ito na maaring kahit malakas ang katawan mo, malakas ang immune system mo, you will still get infected and you will still get sick. And even if you're serious or symptomatic, pwede ka pa rin mag-spread. You can still spread the virus to different people. So this is the basics of COVID-19. Okay, so how do I get infected? Siguro naman alam na natin to. This has been discussed for so many times by may mga articles. Siguro naman we were required by the AATF, by the Labor, by the DOH, na magkaroon ng mga learning sa loob ng ating mga companies, posters to be posted. So we all know what to do. So paano ba ito natatransmit? It's been transmitted by sneezing without the face mask, coughing without, you not wearing a face mask, you not practicing physical distancing, not touching your nose or touching your eyes without even washing your hands. So meron pang lumalabas ngayon, they're saying that COVID-19 is basically airborne. Airborne, not hindi to not meaning na nagta-travel to, but it can be suspended on air. Lalong-lalo na pag walang masyadong air circulation dun sa lugar na pinagtutuluyan natin. So that's another one that it can be transmitted now. Again, it is airborne because it is suspended in air for certain locations without proper ventilations. Mga kalaban natin dito is what we call, I don't know if this has been discussed with you before. I don't know kung nabanggit na ba sa inyo to ng inyong mga private nurses or private doctors. But yes, this pandemic fatigue is part of our company's main programs na lalo na last year when we were hinotel namin yung mga employees, nagkaroon din sila ng, pero pandemic fatigue is very evident this time around. Siguro mga late last year nag-uumpisa na magkaroon ng pandemic fatigue. So what is pandemic fatigue? It can occur when people get tired of the pandemic measures and become less likely to follow public health practices, or simply begin to drown out those messages. A natural sense of burnout can happen since when we've had to stick to these public health measures for such a prolonged period of time. To be honest, nakaranas na ako ng pandemic fatigue mga around January. Medyo naglalaylo na ako dun sa mga certain protocols that we need to follow. But then again, I need to set an example. Tayo, siguro maraming sa atin dito ngayon, mga safety practitioners. You need to be an example to your team members dyan sa loob ng inyong company. When I say lead as an example, ikaw yung mag-practice ng social distancing. Ikaw yung magsuot ng face mask. Ikaw yung magsuot ng face shield. Para pag ikaw ang nanita, hindi ka nila mababalikan. Pandemic fatigue is happening right now. Kung titingnan nyo, nag-ECQ the last time, pero ang dami pa rin tao sa labas. Nasabi lang na MECQ, ang dami pa rin tao sa labas. Para bang gusto ko na kasing lumabas, but gusto ko nang pumunta dito, gusto ko nang mamasyal. Yes, we're not hindering you from going out of anywhere. But then again, we need still to take precautions. Lalong-lalo na ngayon, may mga nabavaccinate na, may mga naririnig nga ako pag pumunta sa restaurant, hindi pinapayagan pumasok. Bakit hindi niyo ako papapasukin kasi I'm already vaccinated with 2 doses? Again, we still need to practice safety protocols. So one of the suggestions that we need to make here is, please also do a program with regards to pandemic fatigue. Kasi kahit may mga programs kayo ng signages, ganitong mga awareness, but if people are getting pandemic fatigue, mahihirapan tayo silang sumunod sa mga safety protocols. So what else? Okay, know the solutions. The basic solution has been given to us. Basic safety protocol solutions. Ano to? Wash your hands with soap for at least 20 seconds. Very basic. Use disinfectants for hands like alcohol or sanitizers. Avoid touching your face, nose, and eyes, lalong-lalo na pag nasa labas. Kung sa totoo lang po, hindi po ako OC. But ever since the pandemic, I don't eat anything na hinawakan ng kamay ko basta po nasa labas ako. Nasa loob ng bahay, pero pag nasa labas ako, as much as possible, kahit nga mani, kinukutsara ko po nasa labas. Okay. Cover your nose when sneezing and mouth when coughing, lalong-lalo na kung wala kayong face mask. Stay at home when you are not feeling well. Ito po, very evident po to sa mga tao. Naiintindihan po natin na kailangan natin kumita. But do sa latter part mo, makikita niyo yung bakit ko sinasabi na if you're not feeling well, please stay at home. Observe physical distancing. Stay healthy by doing frequent exercises. And again, eat healthy and drink healthy. Okay. So what's the next step? Alam na natin ang mga gagawin. Let's do and plan how we use the solutions, these actions that we need to make dun sa companies na. Una, review our HIRA, the hazard identification and risk assessment. Identify the hazards. I believe mamaya madi-discuss din to. You decide who might be harmed and how. Step 3 is you evaluate the risk and decide on the. 4 is to implement the precautionary actions. And step 5 is to review, assessment, and update when necessary. Alam ko naman na majority of you already know how to do the HIRA. Alam niyo na kung paano gumawa nito. Lahat tayo may HIRA sa company. The best thing to do right now is when you do your HIRA, when you review it, i-include nyo na po yung COVID-19 responses natin. COVID-19 actions responses. Kasi yung HIRA natin, wala namang pandemic doon. There's no virus, there's no COVID-19 with regards to the HIRA. Kaya now, if you do review it, include COVID-19 response to the HIRA. Okay. Next. So ano ba yung mga factors that we need to consider when we're doing the hazard identification and risk assessment? Unang-una, how do we minimize workers' exposure to COVID-19? Second, workers returning to work. Yung mga bumabalik, nasa work na kahit sick leave or have been working from home, we need to do this. Next, increase in absences. Paano ba natin ito i-consider na because of COVID-19, bakit nag-i-increase yung work from home arrangements. Hindi po porke nasa bahay sila, wala na silang hazard identification and risk assessment. They're still doing work for your company, so you still need to take care of these people kahit na nasa bahay sila. And lastly, work disruptions such as power and internet. So how do we do all of this? Okay. How do we minimize exposure? Unang-una, let's try to limit interaction. Kailangan mag-face-to-face meeting. Huwag mag-face-to-face meeting. Dun sa company namin ngayon, majority, kahit nagmi-meeting sila, nandun sila sa mga different workstations nila. Just like working from home, but they're still physically in the office, but they don't do face-to-face meeting. Not unless it is really necessary. Then transportation, kung pwedeng makakita ng transportation ng company, why not? As long as it follows the company protocols. I believe it's also included in the IATF memorandum with regards to the provision of transportation to our employees. Also, physical distancing is also dapat in-encourage, lalong-lalo na yung 1 seat apart. Marami ngayon ang nagsasabi na, ano na tayo, MGCQ na or MGCQ na tayo. Pwede na tayo mag 100%. Yes, you can do 100%, but still, please, i-double check nyo kung talagang dapat bang may 100%. Always remember kasi, walang problema kung mag 100%. But if it's not, you're not observing the physical distancing. Isa sa mga magiging negatives nito is, pag merong isa doon na na-identify nyo na nag-positive of COVID-19, mas marami kayong mako-close contact. Mas marami kayong ngayong ipapasend po. Mas malaking gastos, mas maraming damages sa company. Kung gawin nyo na lang hindi 100%, let's say 50% pa rin to. So again, very productive pa rin yung operations nyo. Okay. Next, sanitations of both the employee and the facility, and syempre the use of PPE. Okay. Next, okay. So, what else do we consider? Let's also consider workers returning to work. Marami sa mga offices ngayon is what they do is the rotational work. Babalik tong employee to, pag galing sa bahay, yung employee nasa workplace, siya naman ang mag-work from home. Okay, when people are returning back to work, lalo na kung halimbawa matagal na silang nakaupo, we need to provide orientations on COVID-19 for them. Kasi syempre hindi naman sila matagal na silang wala physically dun sa work. So you need to remind them on what are the protocols, ano yung mga kailangan sundin pagdating nila sa office. Next is to conduct medical screening. Although hindi sinasabi ng DOH na hindi nyo na kailangan magpa-test, COVID test pa para makabalik ang isang employee work. But you still need to conduct medical screening. In some workplaces, they ask the employee to provide a medical certificate for 72 hours. You might ask, why 72 hours? I think it's the base. Most of the doctors, even the medical practitioners, even sa flights, they do require 72 hours of COVID tests or medical certificates. Next is operational changes. Siyempre, mas maraming magbabago ngayon kasi nga may COVID-19. So you need to consider the operational changes that will happen in your operations, maybe in the factory or even in the BPOs. And siyempre, again, wearing of PPE. At again, also, we need to consider mental health. Okay? Kasi siyempre, kung ako matagal na ako nagtatrabaho sa bahay, tapos papasok na ako sa office, tapos hindi naman ako fully vaccinated, may epekto sa mental health ng mga employees na napaparanoid, natatakot, na baka mamaya mahawaan sila pagdating sa trabaho. Okay. So, one thing also that we need to consider also is the increase in absences. Employers should consider an increase in employees going on leaves due to the may sipon, may ubo, may lagnat, may diarrhea, may sakit ng ulo, lahat ito dapat nagsisick leave na. So if you are implementing stricter policy in employees with COVID-19 related symptoms, malamang tataas ang inyong absences rate. Employees residential location with confirmed cases may also be included. Halimbawa, ni-lockdown ng isang lugar at hindi naman siya persons outside of residence, so hindi rin siya makakapasok. An employee member na may sakit, I don't know how it's being done with other companies, but in some companies, pag ang kasama sa bahay ay may COVID-19 symptoms, hindi dapat pumapasok yung employee. Okay, and also transportation. Lalong-lalo na ngayon sa ibang lugar, may kahirapan ng pagkuha ng transportation kung wala kang sariling sasakyan. So definitely, meron tayong mga absences. So paano ba natin ito pwedeng labanan? Okay, you do cross-training. Para halimbawa, itong grupong to, marami silang, they have more employees, wala namang nag-absent sa kanila. So you can get people from one group and transfer it to your group so that it can help with your operations. So cross-training works. Then the next one is proper monitoring of your employees' work hours. Diba? Pwede natin okay, 4 hours dito ka, fast 4 hours dito ka. Kasi mas na-achieve naman natin yung target natin dito. So pahihiram muna kita sa ibang department. Provide transportation. Diba? Kahit jeep lang. Pwede na yan, basta meron lang masakyan at makapasok sa trabaho, and as long as the proper protocols are being followed. Stress and mental health programs, tulungan natin yung mga tao natin na maka-get over dun sa mga anxiety nila as paranoia nila. And syempre, let's give the options of working from home. Now that we know that we do, what else do? We do some work from home arrangement. So ano yung mga kailangan natin i-assess dito? Rotational shift from the physical working hours into the facility and those working from home. Proper ergonomics from home, dapat tinuturuan din yung mga employee o as much as possible. Pag nag-work from home ka, ganito yung table, ganito. Although it's not mandatory, but it's just suggestions that they can. Next is they still need to take regular breaks. Marami sa home, nagkakaroon sila ng dilemma na hindi na daw sila nakakapag-break kasi nga daw pag nasa bahay ka, parang dire-diretso lang ang trabaho. Even if you're working from home, you really need to practice the same what you're practicing at the office. If your break is at 10 to 10:15, you take break at 10 to 10:15. 12 to 1, you take break. 3 to 3:15, you take a break also. So follow the working hours that is being utilized also in the offices. Then you should also have your IT support. Pag nagkaroon ng problema, kailangan meron ng response kagad dyan. At syempre, I would suggest with the leads and the managers that you do regular calls with your team members. If possible, pag nagko-conduct kayo ng virtual call, use a video call. Use your camera if permitting yung bandwidth. Kasi working from home kasi may risk kasi yan na you feel isolated na mag-isa ka lang doon. The difference between having meetings na hindi naka-on ang camera and naka-on ang camera is it gives an additional boost to those employees na nakikita nila yung mga previous friends nila. Lalong-lalo na yung mga taong mag-isa lang dun sa bahay, walang kasama. So I do encourage everyone that when you do calls, do Zoom calls or Teams meeting, buksan nyo ang mga camera mo. Okay? Next. So how do we implement these solutions? Unang-una, you do provisionals for psychological support. Ito yung sa mental health programs natin. Dapat meron kayong mga ganitong mga klaseng program. And then one is the systems to what we call this to the mental health specialists. At the same time, always promote work-life balance. Hindi porket tayo ay nasa pandemic stage, wala na tayong work-life balance. You should always promote work-life balance. Shuttle services. Kung kayo magkakaroon ng shuttle services, strict implementations of wearing masks and face shields inside the shuttle. It's the same thing as physical distancing should also be observed during the trip. Signs must also be placed inside the shuttles and always allow proper ventilation. Kasi with proper ventilation, it really helps to prevent the spread of COVID-19. Okay. Dapat hindi rin sila nag-uusap, hindi rin sila kumakain sa loob ng vans, as well as no answering of mobile phones, specifically kung hindi naman siya kailangan. Again, I know that everybody knows this. Always practice physical distancing in the workplace or even not in the groceries. You go to the mall. Always practice social distancing. Kasi malaki po talaga ang naitutulong ng social distancing. In the workplace, in my workplace right now, they would always say, "Sir, bakit hindi ka pa considered as close talking to people with more than 10 minutes?" So, and then I will always stand. Hindi ako nakikipag-usap sa tao nang nakaupo kami ng side by side. I would always be standing a little bit far away from them and not to stay there for more than 15 minutes. Distancing is very important in the fight of COVID-19. Disinfection. You should always have regular disinfection within your facilities. Not only within the facility, but also with encouraging people to do frequent hand washing. Pero sana naman may sabon dun sa mga toilets natin because usually meron naman kaming sink. There's always free-flowing water, but there's no soap. Okay, wash your hands for more than 20 seconds. Wash your hands after eating, after being from one place to another, and wash your hands before going home, o kung may pupuntahan man tayo, always do that. Okay. So next, just a minute. Okay, so signages. One of the basic things that we can fight COVID-19 is to, may term kami ginagamit na pinupurga namin binubusog namin ng signages sa office. Okay, display signages that always remind them of proper hand washing, to disinfect their workstations, to discourage personal use items and wearing of face masks. You can do it by putting up posters. Messages or even e-messages also in your emails. So, again, sabi ko nga kanina, one of the best way to fight COVID-19 is to have adequate ventilation inside the office. Okay, they should be strictly implemented. So, kung kahit may aircon kayo, magbukas kayo ng bintana. Okay, natural air should always be allowed to flow naturally by leaving our doors open as well as opening some of our windows if possible. It is highly encouraged to turn off the air conditioning or lessen the use if possible. Alam ko po, mahirap ngayon kasi summer. But again, if it's possible, it's really possible, open the windows and some of the doors para magkaroon po ng free-flowing na circulation in air. Next. Okay. So here, one of the basic things that we really need to do is always activate your safety committee. Ensure that proper implementation of guidelines is also to facilitate webinars, online lectures, and training on COVID-19. Hindi po kakayanin to ng safety lang. Hindi lang po kakayanin to ng management. That is why we do have COVID-19 as part of our COVID-19 response. So para may makakatulong tayo sa pagdo-double check kung nasusunod ba yung mga protocols, and to be able to help us also to send out the messages with regards to the protocols that has been set by the company. Okay, designated smoking areas. Ito po yung mga lugar na most common nga na mas maraming kasi nga nakababa yung face mask, nakababa yung face mask, tapos yung blow air na maaaring makapag-transmit ng COVID-19. So yun, if your company cannot really eradicate or stop smoking inside your facility, suggest that you do that you encourage them to strictly walang magsasalita at yosi lang. Yung nga sinasabi ng iba, maglagay kayo ng parang mga phone booth para talagang hiwalay-hiwalay sila. But if you're going to ask my opinion, ang stand ko po is no smoking areas within the facility during the pandemic. Next, let's also reconsider also yung ating mga mark of what we call the most kailangan nating malaman kung meron ba tayong mga senior citizens and individuals with underlying conditions and employees below 21 years old. Mas madaling tamaan ng COVID-19. COVID-19 hits these people, lalong-lalo na sa panahon ngayon. I've seen may mga loved ones po ako na malapit sa I've experienced like in the span of 1 week, I have 3 loved ones who were passed away due to COVID-19. Some of them meron silang mga underlying conditions, senior citizens, kaya yun yung nangyari sa kanila na tinamaan sila. Maximum of 3 days. You're already gone. So again, we really need to take care of these people, lalong-lalo na kung talagang kailangan nilang pumasok. What we do is you ask clearances from their specialist para talagang mabigyan sila ng kung kailangan ba talaga nilang pumasok or they have to have the options of working from home. Controlled meetings and gatherings, kung hindi naman po natin kailangan, mag-meeting ng face-to-face. If you are going to meet face-to-face, always ensure that you're wearing face masks dun sa mga open areas, sa mga confined spaces na working conference room. Make sure na talagang mark yung mga lugar kung saan lang pwedeng umupo so that we can also meal hours. Ito pa, isa sa mga ways to be able to transmit COVID-19 very easily. So sa mga pantries natin, physical distancing, as much as possible, walang nagkukwentuhan habang kumakain. Hindi naman kung makikipagkwentuhan ka sa pantry, you wear your face mask. Walang paghahati po ng mga communal items like tinidor, sausawan, etc. etc. And as well as also eliminate din po natin yung mga pagsasurvive. For us, let's encourage them to do pack lunch para safe. How do we sustain all of this? 1.5 years na tayo with regards to COVID-19. So how do we sustain this so that we can be able to sustain our businesses? It is by doing the management and the workers to really work with each other. Management workers cannot do it this alone without the support of management. Why we do encourage that please work hand in hand para mas lalo nating makatulong sa pag-defeat sa COVID-19. So right now we're going to talk about the COVID-19 response. This is just an ideal setup depending on the budget of the company, depending on how big the company is. Important is we need to break immediately the chain so that it will not spread within the company. Una, early detection. Kung ikaw ay masama ng pakiramdam, huwag ka nang pumasok sa office. Okay? Here, kailangan yung clinic nyo is very strong. Dapat ang clinic nyo na de-detect agad na pumunta yung may ubo ka o deferred. Strong din ang clinic nyo dito. There are some cases kasi na sinabi ng clinic na pauwiin because of the need of the operations, hindi doon. After 2 days, masama pa rin ang pakiramdam, nag-sick leave, pinatest after 4 days, positive. Diba? So you need to have a strong health and safety clinic management in this case with regards to early detection. health declaration. It may be manual, it may be by QR code, but very, very important that you have. Marami ang nagsasabi na hindi naman po yan nagagamit ng maayos. Wala namang tawag dito. Wala namang silbi yung health protocols natin. But yung health declaration, meron pong silbi yan. Yan po yung nagiging way of means na halimbawa nagsabi yung employee, nag-positive yung employee. Aalamin nyo na ngayon, mababacktrack nyo. So, sir, ano pa pala, 10 days ago may sama ng pakiramdam niyan. Tapos ito, dineclare niya, sinabihan na namin siya, ganito, pero pumasok pa rin the next day. Nalalaman nyo ngayon kasi baka mamaya hindi lang nakikita ng nurse kasi malayo yung clinic doon. Unlike in our company kasi, yung main entrance nandun ang clinic. So na-observe ng nurses kung sino pumapasok. But if the clinic is not in the main entrance, hindi nila na monitor kung sino pumapasok. So pag ini-encode na nila yung health declaration, bakit nandito to, wala pang clearance to, they can immediately report to the managers, to the supervisor, sir, kailangan nyo pauwiin to kasi wala pang clearance. So health declaration really works. Lagi na requirements of always remember that it has to be done. Ngayon, mainit. Kung malayo ang nilakad ng employee para makapasok lang at tumunog, huwag niyo namang sabihin po agad na siya ay may COVID-19. Okay? Protocols with regards to that. Next, conduct telemedicine. If you also have your own clinic within you and your own nurses, like for example, 24 hours yung clinic nyo, I suggest you do telemedicine. Halimbawa, may nag-declare na have your doctors or your nurses conduct telecons to your kamusta na po kayo, ganyan on a daily basis hanggang siya ay makabalik. I know it's a lot of work for the nurses, but again, it gives confidence to your employees na kahit pala may sakit ko, di ba? Pag bibigyan ako ng panahon, may nagbabantay sa akin kasi nga walang bukas na clinic, lalong-lalo during last year nung EC2. This was very, very important. Ayun, kung titingnan nyo, do we only do this for sick leave? Kahit pag may nag-positive case kayo, sasabihin, may nagbabantay naman po sa kanilang taga-BERT or taga-RESU or taga-ESU. Yes, I know may nagbabantay. But it's a different feeling po kasi pag ang tumatawag sa kanila araw-araw, isang doctor natin at ang nurse natin. At the same time, syempre, yung supervisor at manager dapat kinakamusta rin, lalong-lalo na pag COVID positive yung tao natin. Lalong-lalo na pag yan ay nasa quarantine. Kung home quarantine, hindi pa masyadong apektado. But when this person is in a quarantine facility, malayo sa pamilya niya, we really need to reach out these persons. Okay. Next, how do we manage COVID cases within the company? Okay. Monitoring of sick leave, clinic management via telemed of employees filing sick leave. Quick decision making ang kailangan nyo para with diagnosis via telemed. Immediate contact tracing and response to employees, strict testing, quarantine and isolation protocols, reporting to LGU and DOH, company assistance to affected employees, and syempre the return to work policy of recovered employees. It is very important that you have a protocol on COVID cases management. Hindi yung tipong pauuwiin mo lang yung employee tapos, mag-quarantine ka lang, hindi ka na namin ipapatest. Each company should have a strong COVID-19 case management, lalong-lalo na pag may positive cases. Alam ko naman na for the past few months, siguro I can say na siguro sa attendees dito, siguro mga around 85% ng mga companies na nag-COVID case na. So how do we prevent it from spreading with the proper COVID case management? So paano? I'll give you certain idea on how, lalong-lalo sa mga large-scale companies with regards to COVID-19 management. Okay, this is how to break the chain immediately para hindi na siya mag-spread. If an employee is considered as a suspect case, the clinic will inform the employee that you need to go to undergo RT-PCR. Okay. Depending on the positive or negative po yung result, the manager needs to conduct an immediate contact tracing kahit wala pa po yung result niya. Okay, now, all close contact should undergo what we call, magastos nga lang po ito, but again, this is, pwede nyong tanggalin yung iba, and i-edit nyo if ever. Okay. All close contact should undergo an immediate antigen testing. Okay, so iiwanan ko po muna to, dito po muna ako sa index patient natin. So, kahit po positive or negative yan, an employee must undergo the mandatory 14-day quarantine. Bakit? Kasi suspect case siya, hindi porket nag-negative po yan, ay maaaring ay negative talaga siya. Maaaring hindi lang po talaga nandun pa lang sila sa early stage ng mutation ng virus. So, maaaring mag-manifest pa ulit, maaaring lumabas talaga yung virus niyan for the next 7 to 10 days. If it's a positive case, you need to immediately report it to the LGU. Kasi ang LGU po kasi talaga ang mag-handle ng COVID cases, hindi po ang company. That is why the employee will need to report it immediately sa barangay or sa city hall or sa LGU nila. Okay, again, after that, the employee will need to undergo quarantine for 14 days. After po siyang ma-release, okay, yung iba ang ginagawa, they proceed to undergo antibody testing or rapid test. Ito po ay para lang malaman natin kung ano na yung level of infection sa katawan niya. Usually, ang ginagawa dito is, ang suggestion is, if it's an IgM positive and an IgG negative, you add another 14 days dun sa quarantine period niya para mag-fully recover siya. If the result turns out to be IgG positive and IgM positive, an additional 7 days. If it's IgM, IgG negative, the employee can return to work. Dun po sa dalawa, plus 7 days or plus 14 days, hindi na po sila kailangan mag-retest after noon. We don't recommend also having an employee who tested positive to retest again for what they call RT-PCR. Kasi po pag nag-RT-PCR test po yan, mas malamang yan, lalabas dyan ay positive. Baka hindi na makalabas ng ng quarantine facility. After they undergo the antibody test, natapos ang quarantine nila, they proceed to clinic for proper treatments. Okay, now, dito naman po, pag again, sabi ko nga, pag nag-negative yung test result, they quarantine for 14 days, then they proceed also for clearance after 14 days. So dito naman po tayo sa contact tracing. Okay, so pina-antigen test po natin sila. The reason why we do antigen testing immediately for close contact is para po ma-determine natin kung merong infected dun sa close contact. Kesa po maghintay tayo ng result, after the next day palalabas, ipapa-RT-PCR mo, after 10 days, that's around 3 to 4 days na kung nasayang na nandun sila sa office. Okay, ang sasabihin naman, sir, pwede naman po natin silang i-isolate muna sa bahay. Yes, I agree with that. Pwede po natin silang i-isolate sa bahay. But if we do, alam niyo yun, yung kung talagang meron, ini-extend natin yung care at pag-aaruga dun sa family, immediate family ng tao, di ba? Mas maganda na yun na ipatest mo sila bago umuwi at kung nag-negative sila, alam na nila na negative sila, uwi sila, at least they know that their family is safe also. And if they're positive, at least you know what is the next action. Okay, if it turns out to be positive, you do an immediate RT-PCR test on the same day. If it's negative, pag nag-negative po yung close contact, iintayin nyo po yung result nung index patient. If the index patient turns out to be negative, the employee can immediately return to work the next day. But if the index patient turns out to be positive, and then if the index patient turns out to be positive, kailangan na po talagang mag-undergo ng RT-PCR on the 7th day po. Okay, on the 7th day po. Hindi po immediately yung RT-PCR natin. It's on the 7th day. Pag nag-positive po yung index patient. And then they go quarantine and then proceed for clinic for clearance. So that's how we manage how to break the chains. This is an ideal setup, but it's not mandatory. It's just an ideal setup. Okay. So how do we, now that the vaccine also is here, so how do we help the government with the vaccination program? Step 1, if you're going to buy your own medicine, you do a vaccine approval. Alin bang vaccine ang kailangan natin? Step 2 is to identify the list, prioritization list, saan yung vaccination locations, kailan yung schedule. Step 3 is to do the administration. partner with the partner clinic, yung screening, pati monitoring, and the step 4 is the post-vaccination and following the adverse effect and the adverse effect following immunization and monitoring. Okay, so almost done with my and I hope this last 3 slides po I summarizes everything that I've spoken. COVID-19 is very dear to my heart, and kasi talaga po ang hirap ng buhay natin. And this has been one of my parang advocacy na maipating sa inyo, and I hope you can share this with your these few questions that I would answer before I end. With proper hygiene, ask yourself, do I wash my hands for 20 seconds or more? Do I always bring a pocket-sized sanitizer wherever I go and use it whenever I can? Do I share my phone, my headsets, my laptop with anyone? Do I always disinfect my workstation before and after use? Do I always disinfect my things when I reach home? Do I always shower upon reaching home? Do I cough and sneeze properly? Please do answer these questions. And let's see and check also, ginagawa ko po ba to? And if you answer yes to all of this, you're helping everybody to get rid of COVID-19. For the face mask, ask yourself, do I always wear my face mask properly and covering my mouth and nose? Do I always wear a mask when I'm talking to others? Do I always touch the front of my face mask? And do I always remove and dispose my face mask properly? Next questions. With regards to travel and distancing, is my travel really essential? Kailangan ko ba talagang umalis? Is the event really important? If I'm going to that event and it's unavoidable, kailangan ko na-assess ko ba sino yung mga who will be the people in the event? Will there be enough space to have proper distancing? Is the venue enclosed or open space? Will the people at home be safe when I go home? Do I always keep my distance from others whenever it is possible? For health and wellness, do I eat healthy? Do I eat healthy food like vitamins that will boost my immune system? Do I get enough sleep every day? Do I practice work-life balance? Do I exercise and keep fit? And do I see the doctor? Why do I need to follow? This is the end of my presentations, and I do hope that you will always remember these 5 things. Usually, ang laging nasa unahan, why do I need to follow? It's the law. But this time around, I'm putting it in the last. The first thing we need to always remember, why do I need to follow? Care for the safety of my family and my family. Saan man kayo pupunta, wherever you're going to party with your friends, always remember that you're still going home to your family after all of those things you have done. I care for the safety of my coworker. Yung mga kasama natin sa office, may mga pamilya sila, may baby sila, may anak sila. Okay? So always remember that you care for them also. And I care for the company. Pag pina-shutdown ng company ng DOLE, ng DOH, lahat kami mawawala ng trabaho. And the last 2 is, and because it's the company protocol and it's the law. Again, magandang hapon po at maraming salamat po. Thank you very much.
Thank you very much, Sir Jerry, for sharing very important insights in, keeping ourselves and our workers safe and protected. This is one of the reasons why I'm still wearing a mask during this session. All right. And in addition to the reminders that we hear and we usually read from social media and, like government announcements, your session actually provided additional tips and information to better our protection controls in this time of pandemic. So thank you so much, Sir Jerry, for that. All right, so now that we've learned more about COVID-19 in the workplace, let's get informed on how ISO 45005 standard can better support us in the midst of pandemic. So let us welcome Kate Field, BSI's Global Head for Health, Safety, and Well-being, where she will tackle on the overview of the new ISO Pass 45005 standard general guidelines for safe working during the COVID-19 pandemic. So as BSI's global occupational health, safety, and well-being expert with over 20 years of experience across all sectors, Kate uses her expertise to drive BSI's global strategy for creating a safer and healthier workplace. Morning to you, Kate, and over to you now.
Hello, and I'm so pleased to be able to join. And it's great that we've got so many people on the audience. And thank you for a great presentation from Jerry. There is a small level of overlap because you won't be surprised to hear that obviously ISO PAS 45005 is about COVID safe working, and Jerry has shared some really good examples about COVID safe working. So there is a small amount of overlap, but hopefully that will just reinforce the points, and there'll be a lot of additional material hopefully as well. So I hope that you will enjoy this session. And if we move on, you've just heard onto the next slide, then you've just heard an introduction about me and my background. I just want to check we've got next slides working. Great, okay. Super. So I've been with BSI now for 3.5 years, and my role is not internally focused, so I don't look after the internal health, safety and wellbeing at BSI, although I support the teams that do that. My role is supporting you, all our clients, our partners, our stakeholders in developing the best health, safety and wellbeing practices for their organisations, so that we as individual workers all get to go home healthily and safely every day. So if we go on to the next slide, then I'll just give you an overview of the session today. So I'm going to talk a little bit more about BSI, just so you have an understanding about the organisation, because quite often we find that people know a little bit about BSI, but not necessarily all of it. So I'll talk very briefly about BSI. And then I'm going to very briefly recap on the controls, but Jerry has covered some of those, so I'll probably move on quite quickly. But then we'll go into what 45005 talks about in terms of risk management, and then I'll give some more details on the actual standard itself to bring it to life. So next slide, please. And I'll just give you an overview of BSI. So British Standards Institution, although we are based, our head office is based in the UK, and that's our heritage, that's where we started. We were the first body to create actual national standards. Back in 1901 we created the world's first standard, and that is our heritage. But we have developed very much since then in terms of offering services and supports to organisations, and it means that actually we have become a business partner to help and support you and your organisations to embed best practice. That is what BSI is about. It's about developing, so shaping, sharing, and then helping you and your organisations to implement best practice. So we do that through a number of different areas within the business. Sorry, previous slide, a little bit too early with the clicking on. And back again, please. So we have a number of business areas. So we do the standards development, and we also have assurance. So that's the part of the business that helps you if you want to become certified, so something like 45005. We do training, we do customized audits, we have a huge range of digital tools, so that, you know, as we've all learnt, we've all become, you know, experts or not so experts, depending on your skill level, about using technology. So we do remote audits now, you know, reflecting the challenges that COVID have brought. We have regulatory services, so they focus on medical devices and checking the quality and the safety of medical devices. And then we have a really large consultancy business, specialising in health and safety and also cybersecurity. So if we move on to the next slide, we are about helping you or your organizations manage risk, but we are now a fully global organization. We have 84,000 clients across 195 countries. So, you know, although it says British in the title, we are a truly global organization. And one of the things I'm most proud about working at BSI is the nature of the work that we do and the standards that we develop and then share with all of you and the wider world, is that our work actually helps and supports you, me, across all aspects of our lives. You know, the products that we buy, the food that we eat, the environment we live in, our healthcare, data security, transportation and infrastructure. So our reach is absolutely phenomenal. And I'm really proud to work for BSI. It's a really amazing company, and it's really great that we get to help and support so many people. So next slide. I will move on now into the main part of the presentation. I'm sure you will all be pleased to know that. So we've heard from Jerry in terms of the nature of the virus and how it spreads. And when I first developed these slides almost a year ago, no, more than that, a year ago, you know, we didn't know as much about the virus. We didn't have as much knowledge. And back then, you know, the suggestion was that the virus wasn't airborne. It was about, you know, the expulsion of droplets when we were talking or coughing or sneezing, and that was the transmission route. But we now know, and very good evidence, as Jerry has said, that actually it is airborne, and therefore a lot of the controls that we had in place have become even more important. So things like social distancing and ventilation and keeping air movement as much as possible, and working outside as far as possible. So Jerry's covered this in a lot of detail. So I will move on to the next slide and get into some of the detail. So, you know, there are kind of 4 principal controls, and Jerry's kind of touched on those, and I'm sure we are all familiar with them now. You know, it's about personal hygiene, it's about social distancing, which I've already mentioned. It's about obviously then trying to minimize contact with people where that is possible. And then it's about obviously self-isolation where somebody is symptomatic or there has known exposure. And of course, now we have an extra potential control, which is around the vaccine and the vaccination program. But I think it's important that we understand that although the vaccine is a hugely important step forward for all of our safety in terms of the COVID-19 virus, we know that although it certainly minimizes the impact of the virus in terms of how ill we get, and there is some suggestion that having the vaccine means that you are less likely to transmit the virus, evidence also suggests that actually you can still transmit, and therefore it's really important that we understand and keep and maintain those other areas of control, so that we are ensuring that we are absolutely doing everything we can to minimize the transmission of this virus. So I see that there's a small problem with the slides. Look, I've got a copy in front of me, so I will keep talking, and hopefully the team will catch up on in terms of the slides. So the slide that is titled Next Normal, which should be slide 13. I'll just see whether, no. Oh, there's an interesting delay. I can see. There we go. Great. Thank you. You're doing brilliantly. This is the team haven't used this platform before, and we all know now, don't we, how difficult it is when you're switching between, you know, whether it's Zoom or Teams or whatever other system you're using. It can always be a little bit challenging. So in terms of thinking about risk management for the virus itself, then this is the elements that 45,005 draw out. So everything I'm going to talk to, I'm going to kind of talk to the controls and then go into the standard, because actually I think people really want to understand details of controls. And what I've done is collate experience that we've had over the last 18 months in terms of clients and organizations that have been managing the virus and some of the great things that they've done. But all of this is also within ISO PAS 45005. So as with any health and safety risk, our first step is to identify the hazards and then do a risk assessment, identify the level of risk. But I think one of the things that we know with COVID-19 is that we need a very agile and dynamic approach to risk assessment. You know, things change. It feels like almost daily sometimes, still, even with the COVID pandemic being sort of 18 months on. Is that our knowledge about the virus and therefore what we need to do within the workplace to protect people is changing. But there are some principles in terms of the risk assessment approach. So the first and clearly the most important is to understand where the transmission can happen and what the exposure points are. So, you know, where are people coming into contact either with things, surfaces, lift buttons, door handles, steering wheels on a vehicle, whatever it happens to be. Where are they interacting with people, either with other colleagues, with customers, with clients, with patients, where they may be indirectly exposed to the public. So while they may be moving from one location to another on public transport for work purposes, during that travel on public transport, they are exposed to members of the public. So we need to identify all of those transmission and exposure points. The next thing that we need to do is identify those people who are most at risk, vulnerable persons. Now, 45,005 doesn't use persons most at risk or vulnerable person. The terminology that they use is simply people who are at higher risk of contracting or becoming seriously ill in terms of the virus itself. But we need to identify those people within our workforce, and also, again, depending on the nature of our activities, the people that we might be working with who are vulnerable. So particularly in sort of healthcare settings, if we are dealing with people who are more vulnerable, which is highly likely, then the level of controls that we need will be different or higher. So identifying those people who are at greater risk is really important. Then thinking about managing our business, and there's a crossover really between sort of business continuity management and health and safety management, which is not always obvious, but kind of the identifying the what activities and the who are essential to do those activities is kind of a business continuity piece. But that's really important. You know, if we have restrictions on the services that we can deliver or the buildings or offices that we can go into, who is essential or who does need to go into those offices to maintain them, even if people aren't working there. So identifying the who and the what are essential is a really important step. Then we have this huge challenge about keeping up with the guidance. You know, the first sort of 6 months of the pandemic last year were just crazy in terms of the information that was coming out from trusted sources. And that's something to be important to be aware of, is when you're looking at information about COVID-19, it is important that you use trusted sources. So the World Health Organization, your local government health authority, you know, they are the ones who are going to give the best sources of information. But there was a huge amount in the first 6 months, but even now it's changing, particularly as we are learning more about the virus. And obviously the impacts of the vaccination program are also having an impact on our knowledge about what we need to do to keep people safe. So we've still got this issue in terms of keeping up with guidance. Then we've got safety critical. Now, this is something that I think organisations are still perhaps not managing as effectively as they could be. So what are those activities or the roles that are delivering those activities that are about maintaining health and safety or safety critical processes? So that's one of the things that we saw last year, is that when organisations shut down their premises, they stopped doing all of their mandatory checks and inspections. So things like water checks, so checking for Legionella, they all stopped. Checking and inspecting fire safety systems all just stopped, and it meant that the either mandatory, the legally required inspections and testing weren't happening, or actually just the risk controls, the regular risk testing was not happening, and therefore we saw an increase of issues for Legionella, particularly water systems. But the other thing that we saw quite a lot of, and I know that this was something that impacted your region, was that particularly for high hazard industries, so petrochemical, where they shut down plants, obviously one of the highest risk activities is restarting plant. And we had an increase in the number of very serious incidents, process safety incidents, particularly related to restarting plants, because organisations were not managing that process robustly and they were not thinking about the implications. So it is important that we maintain that focus on safety critical. And the other thing that's really, really important is that we can't forget the existing health and safety risks. So that this was something that, again, we saw. So the water checks, the Legionella, is a really good example of that. All of the existing health and safety risks basically didn't go away. They were all still there. Their risk profile, so the level of risk they pose might have changed. It might have decreased in some areas, but in other areas it certainly increased. So it's really important when you're thinking about your response and your COVID safe working, that you consider and manage your existing risks. And one of the things that we saw, particularly as an example of this, was as the introduction of particularly face coverings became mandated around the world, there were certain industries, and construction was probably the best example of this, where actually they were wearing face coverings rather than respiratory protective equipment to protect them from the hazards of things like silica dust. And obviously face coverings are not designed to protect individuals from the dust of concrete dust that might have silica in it. So we had some real issues in terms of what organisations were doing and individuals were doing to protect themselves, or thinking they were protecting themselves from COVID-19, but then actually increasing their exposure to potentially bigger health and safety risks. The other thing, and I'll touch on this a little bit later, is it's really important when you're thinking about your risk assessment, you'll focus on, as we always do with risk assessments, your normal activities, your day-to-day routine activities. But you also have to think about those non-routine activities. So things like, when plant breaks down, or when you've got maintenance going on, or things I mentioned about, doing inspections on fire safety systems. So when people come round and are checking fire detectors, that might only be every 6 months or so. So that's non-routine. But if you're having a contractor come in to do those checks, then suddenly you've got a different exposure and transmission point. And therefore you need to consider all those non-routine situations. And also things like areas that aren't accessed very often. So again, plant rooms in building is a really good example of that. People might only go in there every month or every few months to maintain the equipment in that plant room. So how is that plant room being managed in terms of your hygiene processes? And we'll come back to that. And then the other area which organisations have really struggled with is emergencies. Again, I think people have caught up and thought about it, but there's still a lag. So what do you do in a fire evacuation? What do you do if there's a first aid emergency? What do you do if you have another big incident and you have to evacuate your premises? How do you manage that? What's the balance between keeping people socially distanced and getting them out of the building really quickly? And one of the things that we saw was that, and we'll come on to this when we talk about communication, is that people were getting the message about being socially distanced when they were in the workplace, but nobody had communicated what to do during an evacuation when you had to leave the building, such as a fire drill. And therefore people were reluctant to move quickly and get out of the building quickly. So when we're thinking about emergencies, we need to identify those scenarios and be very clear about our communication. And in emergency, the communication is clear. Social distancing doesn't apply while you're getting out of the building. That you've got to get out of the building. What you can then do is once you're out of the building, you can then social distance. And what a lot of organisations have done is things like increase the number of evacuation points. So your cluster, your meeting points for evacuation have increased them for social distancing purposes. So there are a number of areas that you can consider. So if we go on to the next slide, please. Then just some basic principles in terms of social distancing. So we know that for those types of services that can be done from home, that is by far the best control that we can have. But of course, there are a huge amount of services and activities that we can't do from home. And also we have challenges with this technology. It's great if you've got good internet and it's stable and you've got an office where you can work quietly in your own area, but that's not the case for a lot of people. So working from home is not a solution for everybody for a whole host of reasons. So then can we think about minimizing the number of people that are required to do a job or an activity? Those, again, this comes back to those essential and non-essential. So if we think about a manufacturing environment, what's the minimum number that are required to continue the manufacturing? And actually that can help, because there may be people within that manufacturing environment who can work at home. They don't need to be on the factory floor. So there may be adaptations that you can make that way. Then we need to think about our work areas and workstations. And Jerry's covered this, and obviously ensuring social distancing between those working areas or our desks. There are certain environments where that's easier. So an office, that can be easier to manage. But again, coming back to manufacturing and particularly food manufacturing, and we've seen this because they've had some real challenges with high transmission and outbreaks particularly in food factories, is that often production lines are fixed. So you can't social distance because of the way the production line has been set up. So maybe other things that you can think about. So entry and exit points. So actually what a lot of organisations have done is increasing the number of entry or exit points from a location, a building, a premise, or an office, a factory, because that reduces the number of people in that area. But of course, coming back to thinking about the risks that might be introduced, that introduces additional security risks because you've got more access points for people who maybe have bad intentions to get access to the workplace. So as we always do with health and safety risk, as we think about managing a risk in one area, we need to consider whether it is increasing a risk in another area. Increasing toilets or having restrictions in place in terms of which toilets are available, break facilities, lifts, corridors, assembly points, I mentioned for fire evacuation. Jerry talked about smoking and smoking areas, but also things like delivery and dispatch points. So if you've got customers or contractors or drivers who are coming to collect goods from your premises, actually, how are you managing that? How do you managing the social distancing in those scenarios? Can you reduce staffing, so limit the number of people in, or can you do staggered shift start? So again, one of the kind of key transmission points that we get is when people are entering or exiting a building. But if you stagger shifts, then you are reducing the number of people who are coming in or exiting at one time. So that can be a really effective way of actually doing social distancing. I've mentioned increase additional exit points. One-way systems have been really important. I think one of the things that organisations have struggled with is that in sort of set working locations, so an office space, you can manage social distancing. But one of the challenges has been in things like corridors, your transition points, your moving points. And actually there isn't room to do social distancing in corridors. So one-way systems have actually become a very effective way of managing that where that's possible. I've mentioned you have to think about contractors, coming back to our routine and non-routine. Signage and marking has been hugely important. It'll be interesting to see whether some of this stays. You can see in the picture that social distancing in a lift has been managed by marking out in the lift. And you'll also notice maybe on that picture that actually people are facing away from each other, and we'll come on to that shortly. And the other thing that we saw, particularly at the early stages of COVID-19, was a lot of people were doing stuff outside where they could, having meetings outside, doing site inductions outside, having training sessions outside, which of course is great when the weather is lovely, but that is not possible. And again, the other challenge that we've got from a weather point of view is where people are working indoors and have windows and doors open for ventilation. Again, if the weather is extreme, then that's not always possible. So it's really important, if you're thinking about controls like having windows open or doors open, that you then consider what the implications are if the weather is such that you can't do that, and what the implications are, and you might need to change and adapt during that period of bad weather. So if we move on to the next slide, then we'll just have a look at some of the other sort of mitigations. And as I say, these are all examples that are actually part of ISO PAS 45005. And I'll give you an overview of the structure, but people want to know the practicalities, don't they, of managing risk. So I thought I'd start this way. So we've seen the use of screens and barriers and back-to-back working, or not, like in the lift scenario, not facing each other. For certain scenarios, for particularly office, you can book space so you don't have everybody all turn up at the same time to manage the social distancing. I think one of the things that's really interesting, and I'm so curious to see what happens into the future, where we are in the office, and that is likely to be less for a lot of us now. We previously had hot desking. That was a way that organisations were managing the desk space and the number of people in. But of course, that is not practical with COVID-19. So there is no hot desking, and I wonder whether maybe some of these aspects will sort of stay with us going forward. If you can't do that, can you assign equipment to individuals? So, again, I know it might sound like a silly example, but on a construction site, can you assign certain equipment to certain people? Again, that's about minimizing transmission. The other thing that we've seen is where people do need to work together in a team, that they form a bubble. I think, you know, a whole new set of terminology that has come out of COVID-19. So can you create a fixed team so that team always works together? And the reason for that is that it's much easier then to control and isolate that team if somebody becomes ill with COVID-19, because you know that that team is made up of those 4 individuals, and therefore actually they need to self-isolate if one of them contracts the virus. So a really effective way of managing. Vehicles, so this I think is certainly was a challenge and continues to be a challenge. So if people are using vehicles for their work activities, then what are the implications in terms of transmission and exposure? So ideally, if you've got a work vehicle, you only want 1 person in it in most circumstances, but of course that's not always possible. So then how do you manage the risk in terms of, you know, limiting the number of people in that vehicle, and what elements of social distancing can you do? But in most circumstances, it's often relying on having the windows open and wearing face coverings. Ensuring that there are no unnecessary deliveries and certainly no personal deliveries, and stopping that, because again, you know, the more stuff, parcels, equipment, people that are delivering those things, they're all increasing the transmission risk. So you want to reduce all of that as much as possible. And then where you do actually have to have, you know, the nature of your business is that, you know, you are exchanging goods in some way, then can you create no contact delivery collection points? So, you know, we've seen increase in things like contactless payment, but also people putting something down and then stepping away, and then somebody coming forward. So, you know, a number of practical points. And if we move on to the next slide, some of the other things to consider. So one of the things that we've seen with COVID-19 is that clearly when people are trying to communicate within a work setting in particular, then you are increasing the risk of exposure because you're talking to each other. So one of the, I think this is a really good example organisations have used, is rather than going and talking to somebody, even if you can see them, is to phone them or use a radio, and that can be particularly effective also in higher noise environments. And one of the things that we've learned is that high noise environments increase the risk of transmission, and the reason for that is if it's noisy, we have to talk louder, which means that we are much more likely to expel droplets, and those droplets are likely to go further because we project our voice. So, and we saw this in particular environments like meat warehouses. So there were particularly some significant cases of outbreaks within meat factories and meat processing plants. And it was identified that sort of 2 key challenges. One, it was a fixed production line, so they couldn't social distance. But the other big one was they're very noisy. So people were, when they were communicating, were having to project their voice, and that increased the transmission route. So thinking about using different forms of communication is really effective. Limiting the time that people are together when they do have to come together is obviously, you know, practical. The stuff that we're doing, this virtual meetings, virtual training, you know, virtual audits and inspections, that was something that BSI was already doing before COVID-19, but you know, it was less frequent. It was sort of specialized cases. Now it's regular, it's routine. You know, we are doing the majority of our audits in some sort of hybrid virtual way. Communication. I'm going to come back to this. We really can't underestimate it. Questionnaires, declarations, testing is all important. You know, have you been exposed? Have you travelled? Now we're getting questions, have you been vaccinated? Really important to help understand the risk. We heard about thermal screenings, the temperature checks from Jerry. And really importantly, hygiene. And again, I'm going to come back to that, so cleaning. And one of the things, again, that we saw is that organisations were thinking about some of the obvious, like door handles and desks, but they weren't thinking about increasing the cleaning and frequency of things like their ventilation systems, their cool air, hot air ventilation systems, and they're, and obviously they are a potential high risk in terms of, keeping the virus in or keep, or spreading it around. So actually cleaning those more frequently, replacing the filter more frequently is hugely important. So next slide, please. Communication. So I mentioned how important this is, and it's really important to think about who you need to communicate to. Obviously, the workforce, your employees, but also customers, clients, members of the public, contractors who are coming in. You've really got to consider who is likely to be interacting with your workforce in your work premises, and think about the communication that is needed. So, a really good example of this is things like retail, where you've got large numbers of, members of public who are walking through and coming through shops. So how do you communicate how you are managing risk within your shop to those customers? So that's where things like markings and posters become important, but having somebody on the door to explain what the process is, having regular announcements over a tannoy, for instance, it's really important that we consider that communication. And also when we need to give that communication. And one of the things that we've seen is that, particularly where people have maybe been furloughed or have been working from home, is that the first time they go back into their workplace, they need communication to understand what they need to do and how to do it. And this will reflect on the next point that I'm going to talk about in terms of psychological health. There's a lot of anxiety created by change and not knowing what to do. So part of the, our way to manage that anxiety is a communication. And obviously how you communicate. So, what are you communicating, through things like this, virtual online meetings, emails, what are your communication routes? And it's very easy for us to think about, using electronic communication, but of course that's not accessible to everybody. Not everybody has a computer or a smartphone, or the internet, or the Wi-Fi signal is poor. So you've got to consider, again, all of those different groups and how you communicate with them. But also for members of the public, it's really important. So a really good example of this is things like car room sales or sort of car mechanics, those sorts of places where people have an appointment and they're going to come in. So what do you communicate to them before that appointment? What do you communicate to them again when they arrive, to explain the processes and what the expectations are? And again, that becomes really important, because one of the things that we've seen with COVID-19 is an increase around violence and aggression. Really sadly, particularly at the beginning, there were increases of violence and aggression to people who were considered inaccurately to be at higher risk of having the virus and then transmitting it. So particularly healthcare workers, really, really sadly, we saw cases of people who were healthcare workers or known to work in hospitals. So other key workers, cleaning staff, but they are in branded, scrubs or whatever it happens to be, and they were abused on the public transport because people thought that they were more likely to have the virus or be transmitting it. So part of managing those sorts of risks is about communication, and we've seen that with members of the public, in retail and those sorts of scenarios. If they don't know what to do, they become frustrated or angry, and it increases the risk to your workforce. So that communication before people come on site, to manage expectations, to manage anxiety, is hugely important. Providing regular updates as guidance changes, is hugely important. I think one of the things that for those of us who work in more service-based environments, the shift to what's the new world of working going to look like. We have been able to work from home very effectively. For those of us who maybe want to continue to do that, what are our offices, what are our bosses thinking about that? What's that going to look like? You need regular updates. I've talked about customers, and I've talked about obviously signage and lots of posters. Now, I've introduced the issue and mentioned it a couple of times already around psychological health and the impact that this virus has on our psychological health. And when we talk about psychological health, we use a very specific term, psychosocial risk. And I'm going to now ask the team to play a video which explains what psychosocial risk is, all being well if the technology plays.
When we talk about psychological health and safety within the workplace, we use a specific term, psychosocial risks. Psychosocial risks are factors within the workplace and the work we do that can negatively impact a worker's psychological and physical health, or put even more simply, have a negative impact on physical, mental, cognitive or emotional health. Psychosocial risks include the way we work, such as workloads, deadlines, the type of work, isolation and work-life balance. It also includes social factors within an organisation, such as culture, working relationships, bullying, harassment, fairness, and even career development. Other physical and mental hazards, such as high noise, thermal discomfort, physical pain from musculoskeletal disorders, fear of violence and aggression, or even witnessing an incident can also give rise to psychosocial risks. The negative impact that psychosocial risks can cause tend to build up over time, weeks or even months. It can cause physical ill health, such as increased blood pressure, gastrointestinal problems, a weakened immune system, and even impact our reproductive health. It can cause mental ill health, including anxiety, depression, and post-traumatic stress disorder. It even has cognitive impacts, including confusion, indecision, poor memory, and concentration. Finally, psychosocial risks can affect our emotions, causing mood swings, negative feelings, loss of confidence and motivation, and even changing our eating, drinking, and sleeping patterns. But psychological health and safety management is about more than just preventing these negative impacts. It is also about creating a workplace where an individual can flourish. Creating this environment is where the true organisational benefits lie, as unlocking people's potential also unlocks your organisation's potential.
Great, thank you ever so much. So if we move on to the next slide, one of the things that I think we've seen very clearly with COVID-19 is the impact that it has had on people's mental health, their psychological health. And 45005 has a whole section to help your organisation manage these risks, identify what some of the potential psychosocial risks are and some of the controls that you can put in place. And you've got some example here, so workload, for some people working more, for some people they are working less, and that can have an impact on psychological health. So what can you do to manage that? working hours and working pace. So, you know, we've seen unpredictable hours, you know, a lot of long or excessive hours, people who have maybe in this scenario, you know, who are working from home and haven't previously worked from home, you know, they haven't necessarily had the kind of the skill set or the ability to understand how to switch off at the end of the day, or feeling the pressure to need to keep working. You know, a lot of concerns around, you know, role ambiguity and job security. You know, is the way that we're working changing? What does that mean for me? You know, the economic impact of the virus, you know, is my job secure? Is the business secure? Are we making enough money? You know, these are all really important psychosocial issues to identify. You know, we've heard and we are experiencing, you know, the challenge in terms of social support, you know, both physical social distancing, but again, you know, remote working. I heard it said the other day by somebody, you know, in some respects, we've never been more connected. I'm speaking to far more people than I ever did because we can use this technology. But actually, do we feel more isolated because I'm a voice and in a camera on a screen? You know, so actually, what are those challenges? People are worried about career development. You know, they're not necessarily getting the training. You know, people who are new into the business, you know, we've had a lot of this who have started, and normally they get that mentoring and that on the job, physical on the job training, haven't had that, you know, so they're worried about career developments. And I've talked about the concerns in terms of violence, harassment, but the other thing is discrimination. You know, one of the things that we've seen again, where organisations have tried to do the right thing to protect people, particularly those who are more vulnerable, at higher risk. You know, they've said, don't come into work, or you can't work because you're in one of these higher risk groups. But actually, that's a form of discrimination for that individual, particularly if they then aren't supported. So thinking about all of those scenarios and thinking about what you can do to you know, manage that risk. And again, a lot of it is around communication, you know, talking to people to understand what their concerns and anxieties are, and then working through with them by discussing what will help manage those anxieties and concerns, but also then obviously supporting in other more practical ways. So 45,005 has a whole section on psychological health. And if we move on to the next slide, the other area that we've seen start to have an impact on psychological health, which isn't covered because it's really come to light in the last few months, and PAS 45,005 was published in December, is that there's a lot of anxiety and concern for people who are returning to work, returning into the workplace. You know, it's all about change, and people are generally very unhappy about change. But then there's some additional areas to consider. There are concerns and sort of anxieties and tensions between different groups. So those who have kept working and those who have been furloughed. But we are also seeing some concerns now between those who have been vaccinated and those who haven't been vaccinated. So again, as you think about your managing your safe working, you need to think about these scenarios and how you will communicate and deal with those issues. So if we move on to the next slide, then we can actually start to kind of look at the standard and the structure of it and how it came to be. Everything I've covered so far is incorporated within PAS 45,005, but I'll just talk about the details of the standard. So next slide, and I'll talk about the background to the PAS. Now, again, this is a really good example of why I'm so proud to work for BSI. BSI last summer on behalf or working with the UK government for the UK audience, created a safe working guide for helping organisations manage the risks associated with COVID-19. And it was so well received that actually there was, and a lot of countries around the world don't necessarily have the government and administrative infrastructure to help and support organisations on managing COVID-19. And therefore, internationally, it was recognised that there was a need for this guidance. And therefore, this guidance document that BSI wrote was fast-tracked through ISO to create ISO PAS 45005. And PAS is publicly available standard. This means that it's freely available to people. And if we move on to the next slide, then I'll confirm what 45005 is aiming to do. So it's about protecting workers and others from risks of COVID-19. So it's about risk management. And it's about providing a framework using Plan, Do, Check, Act to demonstrate that your organisation is addressing risks in a systematic way, and that you are looking to continually improve and manage the risk, particularly as the changes go on. If we go on to the next slide, I'll just give you an overview of what is covered. So it obviously talks about how you assess the risk, and importantly, it starts with and follows some of the language of other international standards. So although it doesn't follow exactly the same high-level structure of other international standards, it does use Plan, Do, Check, Act, but there are some elements that you'll see are very familiar with other international standards, and one of those is internal and external issues. So under assessment of risk, which is clause 4 in 45005, it talks about identifying and thinking about what's the internal and external context and what impact that will have. So things like actually what's the rate of transmission exposure within the general public, because that will have an impact then on what the level of risk is within your workplace. So it goes through all of those areas. Big focus on leadership and worker consultation and participation. There's no surprise there. Again, although it's not, and I'll mention this a little bit more detail, although it is not based on aligned fully with 45001, the International Standard on Occupational Health and Safety Management System, it draws on and uses a lot of that guidance. And that's because the ISO, the International Technical Committee that turned the BSI guidance into this PAS, are the same technical committee that wrote 45001. So it covers, leadership and participation. It talks about what to do in workplaces if you are working in people's homes, if you're working in multiple locations. Talks about roles and responsibilities, what activities you're doing, thinking about your emergencies, thinking about changes in restrictions, managing illness. So if people become ill in the workplace, but also if they become ill outside of the workplace, your testing, contracting, track and trace systems and quarantine, psychological health. It has a real focus on inclusivity. So I mentioned this challenge that we've seen with people being discriminated against in terms of the controls that have been introduced and not thinking about the implications on that. So it has a whole section and then an additional annex on inclusivity and managing that particular issue. And the other elements that it covers are what you would expect: communication, huge section on hygiene. So cleaning is obviously absolutely critical as one of your controls, but then it's kind of the other management system approaches, so in terms of performance evaluation and also improvement. And if we move on to the next slide, and I'm conscious of time, and we've skipped some polls that we had, but I think you'll probably value the input that we've got. So I've mentioned the relationship with PAS and 45005. So organisations that have got ISO 45001, the International Standard on Occupational Health and Safety Management System, can absolutely use 45005 to bolster that that health and safety risk management, and because they are both based on Plan, Do, Check, Act, you can see that there is an alignment between what you'll find in PAS 45005, the clauses, and what you have in 45001, and that alignment, which means that they can work very effectively together. And if we move on to the next slide, and the next slide, who's the standard for? Well, it's basically for everyone, for all organisations of all sizes, with the exception of high-risk clinical settings. You know, obviously in hospitals and in high-risk care homes, those sorts of settings, the levels of controls are very different and significant. And PAS 45005 isn't designed for that scenario, but it is designed for everybody else, all sizes, all sectors, even self-employed people. It gives really practical guidance about how to keep yourself safe within your work context. You know, and again, it's aimed at giving guidance to protect everybody, you know, yes, principally workers, but then everybody who else might be engaged, so your contractors, customers, clients, and consumers that you might be dealing with. And if we move on to the next slide and the next slide, what are the benefits of using ISO 45005? Well, I mean, you know, it's a global good practice guide. You know, this is at the heart of all standards. You know, it's bringing together international expertise to provide the very best knowledge and experience to help you manage risk within your organization. And you know, it helps in terms of your risk assessment approach. It apply, you know, you can use it so if you're managing multiple sites, you know, you can carry on and think about all of those elements. And I'm not sure, where are we in terms of slides? So yes, so if we move on to the next slide. So yes, in terms of the other things it does is help organisation reduce sickness absence, because you're increasing and managing, you know, your hygiene risk. So in terms of managing the COVID exposure, but it also means that people aren't becoming ill with other things that they might contract, so seasonal flu, all of those sorts of things. And really importantly, it allows you to kind of start to think about this business continuity, to be able to change and adapt quickly as more information comes through. And if we move on to the next slide. So it's been designed to help you and your organisation demonstrate that you've taken effective action to protect workers and others from the risks of COVID-19, that you're doing that in a systematic way by creating a framework that delivers what it needs to and is adaptable as it needs to adapt, and it drives continual improvement. And I think, you know, the fact that it concentrates and has information on psychological health as well as, if you like, the kind of the physical risks associated with the virus, I think is hugely important. And if we move on to the next slide. It obviously supports organisations in terms of any commitments to the SDGs. So it contributes to SDG 3, 8, 9, 10 and 11. So an added business benefit for those organisations that are aligning their health and safety risk management to the Sustainable Development Goals. And the next slide, to bring us to a conclusion. So how do you access it, you know, if you're looking to access it? So the standard, as I've mentioned, is free. It's a PAS, publicly available standard. It's free to read on the ISO website, and it's also available from your local national standards body, and in many cases that has been translated, and you can also access a free copy to download via BSI's COVID-19 webpage. We have a training course available on the PAS, a one-day training course, which is available online or in person. We can do a gap audit against 45005 to see where you are and what your gaps are. so you manage the risk. And we also offer unaccredited certification. Now that's important to understand because it's a PAS and it's a guideline standard. It's not what I call a fully grown up international standard management system. It can't be accredited, so you can't have a UCAS or an ANAB or whatever the accreditation body badge is on your certificate, but you can still get an unaccredited certificate, which is exactly the same process as any other certification, and it still has the same value, particularly from BSI, because we deliver it in exactly the same way as we do, say, 45001, which is accredited, so that integrity and that independent assurance is there. And then we can work on customized approaches if you want that, or some mix of both. So that brings me to the end of my session. I hope that you have found that informative. I don't believe that we don't have time for questions. So thank you very much. It's been my pleasure to talk to you, and good luck and stay healthy, everyone.
Thank you so much, Kate. Indeed, it is very informative. Thank you so much for sharing that. And, we learned a lot about basically COVID-19. And with your session, we learned about the general risks and controls in relation to the pandemic and how ISO Pass 45005 is actually a helpful tool in managing the risks arising from this pandemic, which is COVID-19. So I know that most of or some of the organizations are still pivoting towards the next normal. Now, to cap off this event, I would like to call on, I believe you can now see him here, Mr. Lamberto C. Demano, the president of the Association of Safety Practitioners of the Philippines, Inc., to share his closing remarks. Over to you, Sir Jojo. I believe there is a very few technical issues there, but I hope that we can have Sir Jojo back. If not, well, thank you so much, Sir Jojo, for that short, warm message, and as well as introducing ASPI and the benefits of its membership to all that has joined this session. Now we're sharing with you on your screens our contact details, which you can call and email for your questions related to this webinar. As you have probably noticed that we didn't have a question and answer, just so we could fully cover all the topics reserved for this session. So we are also leaving with you our website details, which you can clearly see on your screens now. Visit the websites of BSI and ASPI to know more of us. And before I let you all go, if you can quickly navigate through the handouts section of your GoToWebinar panel, you would be able to see the downloadable files for your use and reference. So we're sharing with you BSI's 2021 public training calendar, and as well as the benefits of becoming a member of ASPI. So on behalf of the BSI and ASPI teams, we would like to end the webinar by saying thank you to each and every one of you for sparing your time to be with us today. So thank you also to our speakers, Mr. Jerry of ASPI and Kate Field of BSI for sharing their expertise in today's session. Again, I'm Hannah, greeting you a wonderful day ahead. Thank you, everyone. I hope you were able to download the files on the handout section. Thank you.